morning. Happy New Year. Welcome to Conversations with Dr. Johnson.
Good morning, Charles.
And Happy New Year to them, right?
Happy New Year. Happy, prosperous, healthy New Year.
Wow, you've gone straight to the heart of the issue, right? The big resolution is to be healthy. It's the number one issue. So, Dr. Johnson, what would be the guidance you would give as people move into the new year with regard to their health?
Well, you know, I don't think there's anybody on the planet who hasn't heard about the COVID pandemic.
Oh, COVID.
Yes, and
That's a scary thing.
well,
But you don't look scared about it.
I'm not scared at all.
Is that why, Dr. Johnson, you have convinced me not to wear a mask?
I think you convinced yourself.
Okay. And how did we get to that?
Well, look, viruses have been around for millions of years.
Even before us,
Well,
I think they were here before we came.
probably.
Yeah.
I don't think we can prove that for sure one way or the other.
All right.
But probably. And humans have survived viruses for millions of years. How have we done that? We've done that by having a strong immune system.
Yes.
How do we keep our immune system strong in our modern society? Well, number one, we need to eat a healthy diet. Number two, we need to maintain something close to our ideal weight.
So you say a healthy diet, you mean like not a sad American diet?
Not a sad American diet. SAD stands for Standard American Diet, and it is sad. And if you go to the mall and observe the obese people waddling around,
That is really very abusive. You call it waddling?
sometimes it is.
Okay, they're waddling, carrying all that fat around.
We got to call a spade a spade.
Yeah, that must be really traumatic for them, carrying all that fat around.
Well, for some of them, they're carrying around an extra 100 pounds, 200 pounds, 300 pounds. What would happen to me if you put a 300-pound pack on my back? I'd probably say I got to sit down.
Yeah, your knees are gonna go first.
Yeah.
Then your hip.
Yeah.
And we're doing all those surgeries, right?
Yeah.
Anyway, you talked about diet and then you talked about
Yeah.
ideal weight.
Yeah, so it's not possible to maintain a healthy immune system when you're dramatically overweight.
Yes.
We need to get adequate sleep, good quality sleep, and we need to do whatever it takes to reduce our stress.
Yes.
Whether-
And I saw you hesitated on that because that's a challenging topic.
It's a big, huge, challenging
How
topic.
do you reduce your stress when you have children like mine who take off to Vegas during the lockdown?
Well, you have to reprogram your subconscious to just let it go.
Exactly.
But
Very
otherwise,
important.
for stress reduction, exercise can be very useful for stress reduction. Meditation, going for a walk or a hike in nature.
And talking to smart people like Dr. Johnson.
Oh, sure, that'll do it. That'll do it.
It's stress reducing.
Yeah.
Yes.
So then, on top of that, we need the right nutrients to help keep a strong immune system. The most important nutrients to keep a strong immune system are vitamin D3, vitamin C, zinc, and selenium.
Yes.
Those
four. Yes,
Yes.
4 big ones.
Yes.
There are some others you could add.
Yes,
But those are
yes.
the 4 big ones.
And then on top of vitamins and minerals, fairly new research has documented that melatonin has a very powerful immune strengthening benefit, anti-COVID benefit.
Plus the sleep benefit.
Yes. Now, most kids, if they get COVID, they have no symptoms or very mild symptoms. Why? Because kids naturally produce huge amounts of melatonin. Once we hit the age of 20, our melatonin production decreases, and then by the age of 30 is where it really starts to
I used to
drop
think
off.
that my teenage children had problems with sleep. They slept all the time.
That's because of the melatonin.
And I thought they were growing. It was just to give them time to grow.
Well,
Because while they were
that's
awake,
part of it.
While they were awake, they wouldn't be able to grow, right?
Yeah, that's part of it.
Yes. So, what, you need us?
I need him, but I'm ready.
All right, we're going to finish soon. All right, so as we're talking about some of the issues that would come with regard to you taking care of your health in the new year with resolutions, So those are the basic supplements. But what if somebody is already infected?
Well, then they need to take higher doses of those supplements.
All right. So what do you mean higher dose? Specifically of vitamin D?
Are you trying to get me in trouble here?
No. Well, I wanted to explore what you meant by that.
Well, even though it may sound unreasonable,
yeah.
Experience has shown that if you start the following regimen, the first day you develop symptoms, whether your symptoms are cough, sore throat, fever, chills, body ache, severe fatigue.
Yeah.
If you take vitamin D3, 150,000 units per day for 3 days in a row,
Yeah.
the vast majority of cases, the symptoms will be gone by the third day.
All right. Should you also increase the doses of vitamin C, zinc, and selenium, or just the basic amount is okay?
It's helpful to increase the amounts of vitamin C. You can take up to 3,000 or 4,000 milligrams 3 or 4 times a day if
All
you
right.
want to.
Yes. In terms of how much you can tolerate it.
Yes, yes.
Because it also might cause some
loose bowels.
Some loose bowels issues. Yes.
Yes,
So
yeah.
it depends on how
Yes.
much you can tolerate.
Yeah,
it.
so you have to pay attention to what we call bowel tolerance.
All right.
Yeah.
Okay.
If it's causing loose bowels, back off on your dose a little
All
bit.
right. So it's New Year, and there is news that the vaccine is here.
Yes.
And as usual, we're slow, and there are concerns about the vaccine.
Yes.
So I didn't want to put you on the spot about your views on the vaccine, but what is the purpose of a vaccine during a pandemic?
Well, the purpose of the vaccine is to stimulate your immune system to produce immunity against this specific virus. Okay?
Yes.
When we get a natural infection, our immune system jumps into action and starts to fight off the virus. But usually most people go through a period where they're quite sick before their immune system gets fully up to speed and starts killing off the infection.
Yeah.
So the vaccine is supposed to be a way of stimulating your immune system to do the same thing.
It produces
but,
antibodies.
yes, but without having you get sick.
All right. And it's because of the dose they're giving you of that amount
Yes.
of the virus.
Yes.
Right? Because you would think that, why don't just allow everybody get infected and build a natural immunity? But we don't want them to be infected with a higher dose of the virus because that might put them at risk.
Well, that's what they've done in Sweden. They have not
Lockdown.
locked down the country.
Yes.
They're achieving what is called herd immunity naturally.
Without a vaccination.
Yeah,
Yes.
because most young, healthy people are not particularly susceptible to getting a severe case of COVID.
Okay.
They'll tend to get a mild case. They will fight it off. They'll be fine in 5 to 7 days or so. And now they're immune to the virus. So if you get a high enough percentage of the herd, all of the people,
Then,
I guess that means they think we're sheep.
well, I guess so. But I didn't count myself among that.
Okay.
Yeah, because when we say herd immunity, we're reaching 80 to 90%.
Well-
so there is a 10% of people who are not part of the herd. They are the shepherds.
Well, herd immunity, the percentage required to achieve herd immunity varies from one virus to another. For
yes.
one virus, it might be 60%.
Yes.
For another one, it might be 90%.
Okay.
And I don't think we have enough information yet to know what that percent needs to be for COVID.
Yeah, because there are now some concerns that some of the new strains of the virus, the vaccine might not be effective against.
Well, that is a very real concern, and
Yes.
it's a legitimate concern because every year people who get flu shots have to get a new flu shot.
Because
Why? Because the flu virus is constantly mutating, and
Yes.
so every year it's a different mutation coming
So
around.
perhaps from now on we will have to have a vaccine every year for the COVID
Well, let's hope
vaccine.
not.
Yes.
Let's hope not. But at this point, we don't know.
But in the alternative, now there's a big conversation around really strengthening your immune system rather than the underlying concerns of the effectiveness or not of a vaccine.
Yes, your immune system has the ability to fight off whatever you're exposed to, whether it's the flu, whether it's a cold, whether it's a coronavirus, whether it's a mutated coronavirus.
Yeah.
So if we're focusing on the immune approach, that gives us a much broader based immunity.
And yes,
A much
and
better immunity.
a much better and a much more reassuring
Yes.
level of the fact that our immune system will cope against any attacker to our immune
Yes.
system.
Yes.
So I was going to finish by observing whether the hat is something that is improving your immunity.
Well, one of my New Year's resolutions is to get my hair back.
Oh, right.
So-
I thought the hat was a new look
So
for the new year.
So I had a hair transplant last Thursday, 5 days ago, and at this stage after the hair transplant, your head looks completely insane and
Yes.
bizarre. I think it looks like I'm an insane homeless clown. And so I don't want to scare people with the way this looks, so
Well,
the hat covers it up.
Yeah, and I was going to say the hat is challenging. I didn't have a hat of mine, and it's unfair for Dr. Johnson to come across looking like a real hip doctor, and I am looking like the normal Charles. But anyway, thank you for joining. Any last comments as people start the new year?
Well, I would comment that the vast majority of people who get hair transplants, and my hairline was way back here, had to bring it forward. And
Yes.
typically there'll be bruising and swelling that drains down through the forehead, around the eyes, and down into the cheeks.
With a lot of inflammation. Yeah,
Yes,
right.
but if you'll notice, I don't have any bruising or swelling. Why? Because we use this incredibly effective medication called T-Relief, which dramatically reduces swelling and bruising and speeds up the healing process.
Wonderful. That's wonderful. T-Relief, and it comes in tablet and cream.
Yes,
And
and
you
I've
can
been
apply.
using both.
You've been using both.
Yes.
Wonderful.
Yes.
Thank you. Thank you for joining, and welcome and Happy New Year. And join us, love us, like us, comment. And again, thank you for joining the series Conversations with Dr. Johnson. And we'll be here again tomorrow continuing our conversation.
All right.
Thank you, Dr. Johnson.
Happy New Year, everybody.
Happy New Year. Thank you.